Hello, my name is Rochi. I'll be doing a BSN 346 video for you today. It's regarding prenatal education and precautions during pregnancy that we want to take into account. So basically, during pregnancy, there are numerous precautions that we should take into account to make sure the health and well-being of both mom and baby. This teaching video today that I will cover has important guidelines regarding food safety, medications, environmental exposures, substance abuse, travel, and dental care during pregnancy. The goal is to provide comprehensive and practical advice and to make informed decisions during this time, which is very important. So the first thing is foods that we need to avoid during pregnancy. Certain foods pose risks of contamination, infection, or nutritional imbalances that can affect both mom and the fetus. So the first thing is raw or uncooked seafood and meats, because these types of foods pose a risk of Listeria, Toxoplasma, or Salmonella infection, which can lead to miscarriage, stillbirth, or severe neonatal illness. Some examples of these foods is sushi, which is raw fish, rare meats, and some other raw shellfish. Also, unpasteurized dairy products and soft cheeses, because these products also pose a risk of Listeria infection, which can cross the placenta and harm the baby. So some examples of these soft cheeses are like brie, camembert, and blue cheese. Also, we want to avoid fish because it may be high in mercury. So because mercury can impair fetal brain development. So examples of these types of fish include swordfish, shark, king mackerel, and tilefish. Some better fish options or seafood options that are lower in mercury that would be good would be either salmon or shrimp. Also, deli meats and hot dogs, unless the hot dogs are thoroughly cooked to the point where they're already steaming, they pose a risk of Listeria contamination, which can cause pregnancy complications. Also, we want to avoid raw eggs because raw eggs, they pose a risk of Salmonella infection. We want to avoid foods that with raw eggs like homemade mayonnaise, some dressings, and desserts like raw cookie dough when baking. The next thing we want to talk about is over-the-counter medications and supplements. Some over-the-counter medications and supplements are generally safe to use during pregnancy, but others can pose a risk to fetal development. Some over-the-counter medications, such as acetaminophen, which is Tylenol, is usually safe for pain relief and fever reduction. Antacids like Tums for heartburn, but we want to avoid those with high sodium or magnesium content. The next is prenatal vitamins. These are essential to ensure proper fetal growth and to prevent birth defects, particularly due to the folic acid content. The next are medications and supplements that we need to avoid. This includes ibuprofen, which is Advil and Motrin. This can lead to issues with fetal kidney development and premature closure of the ductus arteriosus in the baby. Also, aspirin should generally be avoided due to the risk of bleeding complications unless it is prescribed by the health care provider for a specific condition. Also, herbal supplements. Many of these herbal supplements are not regulated and can have harmful effects on the pregnancy, such as ginseng or St. John's wort. One important tip also is to always read labels carefully and seek advice from your healthcare provider before starting any medication or supplement. The next thing I will cover will be environmental exposures to avoid. Certain environmental exposures pose risks to the developing fetus. These are the most common three to avoid: pesticides and herbicides. Exposures to these can increase the risk of birth defects and developmental issues. We want to avoid gardening or using chemical sprays. The next is secondhand smoke, which increases the risk of low birth weight, preterm birth, and respiratory issues in newborns. Avoid areas where people are smoking. The next is lead exposure. This is usually found in older homes or contaminated water. Lead can affect fetal brain development and can cause cognitive delays. The next one I will cover is alcohol, tobacco, and substance abuse. So for alcohol, generally we don't want the mother to use any amount of alcohol because it is not considered safe during pregnancy. It increases the risk of fetal alcohol spectrum disorders, which can result in lifelong physical, behavioral, and learning difficulties for the child. Also, tobacco use should be avoided because smoking or exposure to secondhand smoke increases the risk of low birth weight, preterm labor, and sudden infant death syndrome. Smoking also reduces the oxygen supply to the fetus, affecting its growth and development. Also, we want to avoid illicit drugs. Such examples would be cocaine, heroin, and methamphetamines, because these can cause serious harm, including preterm labor, low birth weight, neonatal abstinence syndrome, and long-term development and behavioral problems. So we want to seek assistance with our healthcare provider for support and services to quit smoking, alcohol, or drug use during pregnancy if the mother is using. Now we come to travel precautions that we would take during pregnancy for the pregnant mother. So the best timing for travel, the safest actually is the safest time to travel usually would be during the second trimester, which is 14 to 28 weeks, because nausea often subsides and the risk of preterm labor is low. So when preparing for travel, we want to let the mother know to wear comfortable clothing, drink plenty of water, and make sure to move around every 1 to 2 hours to prevent blood clots, particularly during long trips. Also, the use of compression stockings to help improve blood flow, circulation. The places we want to avoid when traveling for the mother would be places of high-risk diseases, such as areas with Zika virus, malaria, or other health concerns. The next thing is, when is it not safe to travel? Travel may not be advised after 36 weeks generally, or if there are complications like preeclampsia, multiple gestations, or risk of preterm labor. Also, we want to avoid prolonged sitting risks. So when traveling, sitting for long periods increases the risk of deep vein thrombosis or DVT. So to prevent DVT, we want the mother to move frequently, stretch their legs, and stay hydrated. So walking and regular exercise are particularly important during air travel. And then lastly, I will cover dental care during pregnancy. So the best time to visit the dentist will generally be in the second trimester, which is the best time for dental cleanings and routine care. It is safe to visit the dentist throughout pregnancy, but avoid the first trimester, if possible, due to the risk of nausea and discomfort. Dental procedures and x-rays. Necessary dental procedures like fillings, having extractions, or root canals can be performed safely during pregnancy, especially in the second trimester. Dental x-rays are also safe with appropriate shielding to protect the abdomen, but we should only be done absolutely if necessary. So some common dental issues. During pregnancy, there's a chance of gingivitis due to hormonal changes. Gums may become swollen, tender, or may bleed easily. Also, there's an increased risk of cavities due also to hormonal changes. Dietary shifts, which may increase the risk of cavities. So always maintaining good oral hygiene is essential. So in conclusion, by following these precautions during pregnancy, we can help ensure then that mother and baby are healthier during this journey, and always stay informed. And if communicate with your healthcare provider if you have any questions or concerns and about any of your specific pregnancy needs. And that is the conclusion of my video. Thank you.